I'm Nicole Matar. I'm an anesthesiologist and interventional pain management specialist at HSS, practicing primarily in the Stamford and Westchester offices. About 4 in 5 Americans have back pain. I would say that's the most common condition that comes by. That's neck pain, mid-back pain, low back pain that can be related to arthritis, herniated discs, muscular pain. Additionally, other types of pain patients come by as well. I treat patients with peripheral joint pain, nerve pain, muscular pain. So my approach to patient care is primarily conservative, multidisciplinary, and collaborative. I think those would be the way I would describe it. Ideally, when a patient comes to see me, we are trying to come up with a game plan for them to help with their pain that is the least aggressive management plan. So, conservative options, things that they can do themselves at home to help themselves get out of pain. If for any reason we really can't get them out of pain in such a conservative management plan, then the goal is always to help them with injections or correct referrals to the surgeons to help them treat whatever is going on. Yeah, so patient care for me is extremely collaborative. The goal at the end of every single meeting for me is to establish a plan with the patient. I want to be able to give a patient a toolkit for them to use to help themselves rather than have to come back to doctors regularly. So my goal as a physician, especially a pain management physician, is really to get patients out of discomfort. Patients who come to us are really uncomfortable, they're not able to live their life to the fullest, and the goal is always to help them get back to the activity that they were once able to do that they're no longer able to do because they're in pain. Patient education is the most important aspect of patient care. Helping a patient figure out what is going wrong, explaining that to them, and then giving them options to help themselves with their pain is a really important factor of pain management going forward. The most satisfying thing as a physician is to be able to see success in a patient. When a patient initially comes in with pain and you're able to get that pain down either to 0 or to a much more livable place, that's the most satisfying part of this job, right? That's why I went into this specific career,